Well, ever look in the mirror one day and notice a new area of your body starting to age in ways you weren't expecting? Sure, we kind of expect wrinkles on our face to some extent, but when our arms start sagging or our cleavage is looking crinkly, might be time for some intervention. Dr. Ann from Ann Therese Aesthetic Medicine, here with a new use for kind of a tried and true product. So good to have you, Dr. Ann.
Thanks for having me.
So Sculptra, it's an injectable. We've talked about it kind of used on the face in different areas, but now it's kind of moving on, right?
Yes, we're using it off the face. Sculptra is a polylactic acid. It's mixed with some sterile water, so it's a very thin kind of filler with these little polylactic acid particles, and it generates collagen for 2 years. So it makes skin, crepey skin or volume depleted skin. It gives it that plump kind of turgor again, and it also gives people just kind of a nicer sheen to the skin because collagen always gives just a better reflection. So people like their skin better after Sculptra too.
And we were just talking before this about those areas that you don't always notice until you get to a certain age.
Exactly.
And one of those is your upper arms.
Upper arms. We get a lot of women coming in saying they just feel like it's been crepey. They're working out, they're doing everything they can for the muscle tone in their arms, but they see this kind of crepey skin or just kind of a little bit of a wrinkling in the upper arm, and this is an excellent area for Sculptra.
All right, let's look at the first before and after then and see kind of the results for what this woman went through. And how many kind of treatments do you need, or what's the process like?
Usually I start with one vial split between both arms, and 3 months, anywhere from 2 to 3 months afterwards, we'll add another vial too, because we'll see how much grows, how much that collagen kind of fills in, and then we do another vial 2 to 3 months afterwards. And it's a very comfortable procedure. I do it with a cannula instead of a needle, which means we just kind of numb up one little spot, and the cannula has no sharp edge. So something's being done, but very comfortable. People don't find it painful at all.
And then they see those results pretty instantly, or does it take a little while?
There is some instant gratification to it because there is that water mixed in with the Sculptra, and so it basically plumps the skin immediately. We have patients do a massage of the area, just kind of rub the area 5 times a day over the next week, and that kind of dissipates those little PLLA particles, and then that's when the collagen begins to grow.
And this one looks amazing.
Yeah, just that kind of wavy skin that we all get when we start to lose collagen.
All right, the next area is the décolleté or cleavage kind of area on a woman. Has that area, I feel like, been getting more attention lately?
It has, because a lot of people have taken care of their face and maybe even their neck, and then they notice there's pigment on the décolleté area, or if they're a side sleeper, maybe there's some wrinkles or crinkles there, and just sun damage too. Sun, a lot of times we keep our sunblock on our face, but maybe not always our neck and décolleté area. So you can see kind of those vertical crinkles there, and then that is just the area that we inject some Sculptra very superficially under the skin, and it does a wonderful job of kind of building collagen and getting rid of those little vertical crinkles.
And I feel like she's going to be a lot happier now that we're heading into the warmer weather and putting on those tank tops and just kind of noticing that it's not as, dramatic of wrinkles that you're going to see in the mirror.
Exactly. I have women come in all the time saying, I live in fear of old lady chest, and I'm seeing it. So those little vertical lines, those are an excellent candidate for Sculptra.
All right, so how long does this last, Dr. Ann?
This is a 2-year filler, which is really nice. It's what I call a biomodulator, meaning it stimulates your collagen to produce. So it tends to get better and better over the first 6 to 12 months, and then usually the result lasts until 2 years, and then people usually come in for a little booster if they like that.
All right, so if somebody is out there looking to, and they're thinking, I don't know if this is what I want to get or, the procedure that I need, you guys always offer complimentary consultations.
Always. Just because we want you to come in, we'll take a medical history, make sure that this product is right for you, show you some good before and after pictures of people who may have the same skin type as you, so you can see what the expectation is and have a reasonable expectation of what to assume. And then we always give a special for the daytime viewers. It's 20% off if you mention daytime.
All right. It is called Sculptra, so give Dr. Ann and her team a call. Thanks as always, Dr. Ann.
Thanks so much.